Good evening, everyone. This is Cruz Sherman, the CEO of Cruz Inc. Global and Cruz Inc. Radio 102.8. Thank you for joining us again for this telecast, our live broadcast. We invite you to watch us not only on my private Facebook page, where we invite you to go to our Cruz Inc. Radio Facebook page and also our YouTube Cruz Inc. Radio 102.8 TV channel. Tonight, this is kind of a catch 22. We have a very special guest with us, and that's Dr. Jonathan Shepard, who is a psychiatrist. And I think with all of the events that have been going on today, even though this was not necessarily planned, I believe that what we're going to cover is going to be beneficial to the country at whole. Dr. Shepard, welcome to Cruz Inc. Radio TV.
Thank you, sir. Glad to be with you all today.
I want, if you can, to give everybody your background. I read the bio, and I will say that your credentials are just phenomenal. I saw the part about Doctor of the Year and some other credentials. So tell my audience and introduce yourself if you don't mind.
All right. Well, first of all, greetings to everyone. Once again, I am grateful to be with you all tonight. I am Dr. Jonathan Shepard. I am a practicing physician here in Baltimore, Maryland. I trained at the University of Illinois College of Medicine. That's where I received my MD. And then I also stayed there for my adult and general psychiatry residency. Then I was fortunate enough to travel to Johns Hopkins University School of Medicine, where I did a fellowship in child and adolescent psychiatry, which is my specialty. So I'm board certified in child, adolescent, and adult psychiatry. And then I stayed in Baltimore and am now the chief medical director of Hope Health Systems, which is the third largest provider of children's mental health services in the state of Maryland. We're well known, well diverse in the community. And so just glad to be with you all today.
Doc, thank you very much. I want to, first of all, we know that there's psychiatry and there's psychology. Can you break down the line of demarcation between the two?
Absolutely. So a psychiatrist, we go to medical school. We train and learn all the different specialties, just like any other medical student. At the end of our 4 years, we choose to go into psychiatry. And that was my choice. One of those things that at first I was like, man, I don't know a little bit about that. But sometimes people think that psychiatrists actually need one themselves. But I was thankful to choose this profession, and am very grateful that I did, because it has opened up so many different doors and opportunities, especially for people of color who have myths about psychiatry. Again, psychiatry, we're able to prescribe medications, we're able to perform all the different treatment modalities. Beyond just medications, there are even some surgical procedures that psychiatrists do. And so I just want to make sure that people understand that psychologists, they vary. Some of them just get their master's in psychology. Some of them go all the way up to become a PhD, ID. I believe that's kind of the highest. But they do not attend medical. They prescribe medication.
Thank you for breaking that down. In fact, we're hoping to have a psychologist on this week as well. But we're going to deal with, because you get more into the nuts and bolts, especially depression is one of the most common mental health issues that a psychiatrist can treat. What are some of the common, triggers for someone that goes through depression?
Absolutely. So triggers for depression can vary, multifactorial. Be environmental factors, which we may even get to some today. Just growing up in certain areas, believe it or not, can cause one to be at risk for depression. If you're continuing to be exposed to violence, exposed to trauma, exposed to anxiety events, it can make you more prone to experiencing depression. There are even stats about women being more prone to depression than men, and that just proves to be what depression hits everybody, doesn't matter what age. Um, Actually, it is the number one core morbidity. I'm sorry, the number one disease in the world that causes the most comorbidity. I'll say that. It's even over in heart disease. So depression. But
Wow.
I'll say this: then you can have a perfect life and still become depressed because there's something that goes wrong inside of your head, inside your brain. So you can have a perfect life, the ideal life, situations. But when something occurs inside of your brain, and you don't have enough what we call neurotransmitters, and I don't want to get too technical there, it can cause a person to be more at risk for depression.
We're finding, especially in this new norm now, that, um, and I'm just guessing, but I want to ask you: have you seen uptick in depression since COVID-19?
Yes. I honestly tell you what the most common thing I've seen is anxiety. Anxiety is actually the most common disorder. And I mention anxiety because anxiety and depression run parallel. They're like kissing cousins.
Hmm.
70% of people who have anxiety have depression, and vice versa. 70% of the people who have depression have anxiety. So they run neck and neck. Yes, people are definitely dealing with depression. Again, you're looking at the different situations that have occurred. Some of them are situational. Some of them are due to economics. If you've lost your job, if you lost status because of certain things that have occurred with losing your job, grief, loss of loved ones, and again, my heart goes out to any person who has lost a loved one due to COVID-19 or even during this season at all. It doesn't have to be to the coronavirus. Just to have a funeral now is such a big deal because you can
Absolutely.
no longer have a traditional celebration service. And so it is, I think right now, uh, I was reading something that says mental health disorders right now is a parallel pandemic. I agree with that. At first, I was thinking it's going to be the next wave, but no, the wave is already here. It's a parallel pandemic to what we're dealing with in regards to the coronavirus.
Yeah, absolutely. Because again, death, as we know, is a traumatic experience, especially when it's a loved one. But now we're going through this mode where even if a loved one is sick in the hospital, you can't be there by their bedside, especially if they have COVID at this particular time. You're not able to enter a lot of the hospitals, facilities, nursing homes. So, again, what you just stated was that the anxiety level now is perhaps higher um, due to a number of different circumstances. What are some of the things that I know when it comes to psychiatry, you all can do, like medication or psychotherapy? And I like for you to, again, draw a line between when is a case for medication and when there's a case for psychotherapy.
Absolutely, absolutely. So, what I do in helping to define when medication is necessary, I use the word disorder. So, disorder means the inability to function or the lack of order. Anytime there's a lack of order, that's when medication needs to be considered. So when you're dealing in the realm of mental health, the first line of therapy, the first line of treatment, I should say, is individual therapy. So that should be your first line is therapy. Now we recognize that many of the disorders that we deal with, alone is not going to do it. And again, that's where your psychologists, your clinicians, therapists, they're the ones who really specialize in doing therapy. I learned how to do therapy, but that's not really my specialty. And so that is necessarily um, that is a necessary must for mental health treatment is therapy because you need to be able to talk and be able to get some of that stuff out that you're dealing with. Now, medication comes into play when you've been doing that or you have tried that and you're still not functioning properly. Let's take a case in point in depression. When you know that you're unable to eat or you're eating too much, you're unable to get yourself out of bed, your hygiene has been deteriorated, and various other things. I can go down a checklist. And we've been using individual therapy and it's not working, and you know you're not functioning. That's when medication needs to be considered. Medication for psychiatry is just like any other specialty. When you have a disorder in your liver, there should be medication that should be considered. You have a disorder in your pancreas, which is called diabetes most of the time. There are other things that can cause a disorder in your pancreas. If you have a disorder in your heart, if you have a disorder in your lungs, something like that, where medication needs to be considered, it's the same thing for psychiatry. When there's a disorder in your brain, and that's where a lot of the mental health issues arise from, then medication needs to be considered. You just need to make sure that you're with somebody who understands that. A pill is not going to be the cure-all for most of these disorders, but medications comes in and allows for us to be able to manage those symptoms. So now we can actually teach you or be able to assist you in the different modalities so we can help you. Let's say, for instance, for anxiety. The medication reduces the anxiety, so now the therapist can work and teach you those practical tips on how to be able to breathe correctly, how to be able to handle those stressful situations.
I want to tell our audience, those that are currently still tuning in right now, we're talking to Dr. Jonathan Shepard, who is our psychiatrist, and we're going to get into something in just a few minutes that's going to be real deep, and we're going to be talking about some PTSD, and we're going to be talking about a recent event, several recent events, and how it's having an impact probably on a lot of people right now. But I want to go back to something that you said earlier. It was part of my questioning. When it comes to the people of color, traditionally and historically, we've seen even talking about mental health issues and even talking to a psychiatrist as taboo. Why, in your opinion, is it such a, even in 2020, it's still a taboo subject, especially among Black men?
Absolutely, absolutely. Number one, the fear of the unknown. When you think about medicine, medicine is supposed to be something where you can put your hand on something, you can feel it. It's very factual. So even with my colleagues, people would tease me, well, why are you going to psychiatry? You know, that's just whatever. So a lot of us have issues with not knowing how the brain works. And we still are developing theories and different ways of understanding how the brain works. So I believe that is one of the main reasons that we don't really understand why we do certain things or understand why my thoughts went a certain way, or if the brain gets ill, what we can do about it. So that's one of the major reasons. Another major reason is because as people of color, we have been abused and treated improperly when it came to clinical trials, when it dealt with mental health disorders. Let's think about the Tuskegee experiment. Uh,
Mm-hmm.
think about the different things that happened right here in Baltimore. Shameful to say, but it is true. And Johns Hopkins even had to acknowledge and apologize that they would test people of color who lived in that area and provide experimental drugs. I'll just use that word, testing it out. And so people of color became very skeptical, even about that institution as a whole, and still are to this day skeptical about Johns Hopkins, believe it or not. So those things occurred. And then we have to think about faith, um, the faith community, which plays such a large role in the people of color's lifestyle, community, even in their belief system, even in their ability to feel good about themselves. And so when you go to your faith institution, you would hear many times negative responses or negative actions or negative beliefs or attitudes. That's probably the best word about mental health services. People would tell you, just get over it, pray about it, God got you, and you know, it is done. And you sitting
Mm-hmm.
there like, okay, I done prayed about it, I done did this, I done, and I'm still struggling. And that's one of the major reasons why people of color also struggle when it comes to mental health disorders. Now, regarding men, look, you can be a white man and still struggle to go to get mental health services. It's just something about a man that, you got to be able to reach them a different type of way. And let me just tell you, during this time, I'm about to end right here, I've seen more Black men come into my practice more so than ever before because they realize that they need help.
And that's good. I am glad to hear that Black men and men in general are starting to understand that it's not macho to walk around the house, with thoughts of wanting to beat your wife or kick the dog or the kids and all that kind of stuff. That's not natural. That is abnormal. So kudos to the men. I'm going to go to a question here, and then I'm going to go back because I have a question. So this comes from one of our listeners right now. Miss Jessica Taylor says, "What happens when it's time to get off the medication? I think people are afraid of the side effects and what the addictions you will have to the medications once stop." Is that consistent with a lot of times reason people kind of shy away from the medication and the side effects of them?
Absolutely. So it's a very legitimate question. So again, it's being in touch with whoever the person is that you're working with, sharing with them your feelings, sharing with them your fears, and so that doctor who is working with you should be able to answer those questions. Hopefully, give you some type of reassurance that this is the right thing for you to do right now. Now, again, it's called the practice of psychiatry because there is no 100% guarantee. I'm not saying, I know some doctors might cringe when I say that, but that's just the truth. We are practicing. But with practice, we do eliminate those things that we know are not as useful. And so we have a checklist. So when a person is going to be put on medication, it is my duty to talk about those side effects, to talk about the benefits, to talk about the side effects, to talk about the risk. So if your doctor doesn't do that, then you may need to go check out another doctor because that is what we're supposed to do as far as informed consent. That is called informed consent. Now, when I put a person on medication, we have a deal once we first start. The medication is to be taken consistently for 1 year, right? Now, some people, well, my God, that's a long time. 1 year goes by so fast. And let me tell you, most people can't even last a year. I had a mentor tell me, Dr. Shepard, actually just call me Jonathan because he's my mentor. He said, "Jonathan, if the people listen to what you said, they will put you out of business." I said, "What you mean?" people gonna start feeling better, and before that year is up, they're gonna be off that medication, and then 2 years down the line, they're gonna be like, "Man, I need that doctor again." So they're gonna be recycling right on back. If they stayed on there for that 1 year, their life could potentially have changed. And so, I tell people that especially when you're dealing with depression, dealing with anxiety, you remain on your medication consistently for 1 year, and we reevaluate after 1 year to decide whether or not do we go up, do we go down, and actually we actually do that beforehand. I should retract that statement. So we will find a therapeutic dose. Once we find that therapeutic dose, then it's 1 year from there. Then we'll decide whether or not do we titrate. Some people can't come off medication. I take people off medication all the time. So you don't have to stay on medication for the rest of your life. Then I have some patients, they need to be on medication for the rest of their life in order to keep them stable. And that's just the truth about it. So I think I answered.
Yeah, absolutely. And I appreciate that bluntness and that honesty. And I want to say to all my Christian friends here, let me preface this because I pastored for 20 years. So what I'm about to say is not hypothetical here. It's based on as doctors practice. Early on in the faith community, we did not do a very good job of recognizing and dealing with mental health issues in Black churches and pretty much a lot of churches. I don't want to just label everything Black, but I can only expect from what the Black experience right now. I think we have gotten better. Can we do better? Of course. Uh, and again, it goes back to that thing of where I always said that, uh, yeah, we pray, we have faith, but the Bible says faith without works is dead. So you have to put some faith, and then you have to seek out help that you provide. Would you be inclined to agree or disagree, Dr. Shepard? And you can't disagree on this show.
No, no. Actually, Pastor, I came to back you up. Proverbs 18:14 and said, "The spirit of a man will sustain his infirmity, but who can bear a wounded spirit?" So that's one of my mottos. Proverbs 18:14. What that tells me is that if your mental health is together, it will sustain any type of infirmity you go through, any type of sickness, any type of illness, what type of adversity. We got to have our minds right. And so I know that, in the Christian community, they always talk about keep your mind, stay on the Lord, things like that. But it's interesting when they say that, but they don't want you to keep a healthy mind,
Mhm.
sometimes with a healthy body. And so we got to make sure that our mental health, which is just as important as any other spiritual health, physical health, emotional health, we got to make sure that all of that is healthy, because when you go through, and it's been shown in research that if you have a good mental health, even when you have cancer, you have better outcomes.
Mhm.
When you're dealing with other surgeries, if your mental health is together, you're able to normally recover and bounce back much faster and much quicker. But if you're depressed, if you are low, always anxious, and haven't dealt with your mental health issues, your outcomes tend to be much worse and much poorer.
Absolutely. I am a firm believer of that. And being a pastor, growing up in the hard streets of Memphis and overcoming a lot of things, including racism and being a victim of racism, I, I believe that it was my faith that brought me through, as realizing also developing, as you just indicated, a strong mind. And that's what I try to teach my sons. I teach anybody that I come into. You have to have a strong mind. In fact, I think Paul said that we have to arm the whole body, and he mentioned the helmet in this, and that helmet has some symbolic meaning in terms of, again, protecting the mind. We have to be careful what we ingest, if that's correct. How about, we are inundated with so much social media now. We get things at lightning speed. And so we're bombarded with so many different levels of depressing information that's creating anxiety. In fact, we're going to play a clip in just a few minutes. How do we get that balance, Dr. Shepard?
Turn off that TV. you have you have to get your intake, especially now. I mean, everything is so fast, and everything is breaking news. Everything is not breaking news, but that's how they get your attention. It scrolls across your screen, your phone. You can be in your car, and they come across Sirius, XL. I mean, it's like, man, it's on overload. We're on sensory overload, because there's so much that is coming into our brains, and we weren't built to handle all of this. And so you have to know how to cut it off. There are days now when I'm working from home, I do not turn on my TV. I'll go the whole day and my TV is not turned on, and I'm okay with that. And so we have to get to a point to where you don't have to turn on the TV for news. You don't have to turn, because I'm telling you right now, most of the news is not changing. All they're doing is updating, how many people have died from coronavirus, or how many the virus is now. Now we're starting to get a few other things, necessarily with the economy. But again, 95% of what we hear from the news is related to COVID-19. So you have to learn how to turn it off. let me tell you, for those parents who have children out there, you've got to regulate this. You have to, because your child is intaking so much into what he or she is watching that if you're not monitoring this, then they're going to find out some things that either A, you didn't want them to find out, and I'm not saying you should hide anything, or they're not find out the way in which you would have preferred for them to find out. And now it's going to cause so many other questions. Children are really battling, as to how much information they should be taking in. And with them already have been disrupted from being pulled out of school, let me tell you, children are fed up to here. I'll say this: a 15-year-old guy today, and I mean, he just says something that's just so blunt, but it just really exposes what they're feeling. He said, "Dr. Shepard, I'm tired of this. I just feel like, the next 2 days I'm just running away. I'm just sick and tired." I mean, he was done. I was not built to live like this. I was built to be around people, around friends, around my family. I'm tired of it. And I know some of you all out there are just like that 15-year-old, sick and tired of this. But we have to learn how to keep ourselves together, how to bring it back together, and teach them how to be able to manage those feelings and know how much to take in so you know how much to handle so you don't get yourself overwhelmed.
You're absolutely right. In fact, we were having a conference call with my team just last week, and I said, what are some of the things that you guys are thinking about? And my team said, Cruz, we understand the severity of the pandemic. We understand all that is going on, but again, just like that 15-year-old indicated, people are tired. We see a lot of anxiety now. People are getting short-tempered. We have debates about whether to wear a mask or whether not to wear a mask. We have that big debate whether or not we should open up for the economy's sake versus closing down and saving lives. And there have been some people that have been very blunt in saying, well, open up the economy, and if they're going to die, they're going to die anyway. That's where we are, I guess, and that's causing anxiety on both sides. And is there a silver lining somewhere? I know there's no magic bullet to all this. So where do we go in terms of trying to find that balance, Dr. Shepard?
Absolutely, absolutely. And you kind of are alluding to it right now. We have to strike a balance. We have to be able to recognize and be in touch with how we're feeling, how we're doing. One of the things that I really have been stressing with our families and who have children, and even just the adults too, take time, listen to what people are telling you. If you have an elderly person out there, this is the time to pick up the phone and call them. Don't do that much talking. Just listen to what they have to say, and just hear what people are saying. And as you're doing that, you hopefully will be able to find some type of medium, some type of balance on how to be able to help that person. One of the things I recognize in being in psychiatry is that people will actually tell me their own remedy or solution to their own problem. And I believe that for other people. Most times is that we just talk, keep telling people no, you need to do it like this. No, you got to take this step first. No, be quiet. Ask people how you doing, and then step back. And in their doing so, you'll watch how people start. I'm gonna go back to that 15-year-old. I could have been like, man, you just need to do it like this, man. I mean, but no, I kept, gently, pushing him just a little bit. Before I knew it, I'm just sick and tired. It took a few minutes for him to say it, but that's what people are needing, that outlet. And so some people though need a different level of outlet because they're not functioning. If you know that you're not functioning, you need to make sure that you have someone who can assist you to get back in line to where you need to be at. And sometimes that requires mental health treatment. What I'm afraid of is that we're going to have a lot of people who are too scared to come out.
Mm-hmm.
Too many people who are scared to go out when they're now feeling heart attack symptoms. I hear newspapers saying that heart attacks are down, strokes are down, and I'm just like, you're wrong. People are just scared to go to the hospital to go
Mhm.
get treated. And so now when they end up in the in the emergency room, they're at a much worse state. So I don't want that to happen regarding our mental health patients. I will say this. So you want to make sure if you're overwhelmed, ask for help, but also begin to have structure and consistency. I know some people are like, man, how do I develop that? Well, one step at a time, one day at a time. If you know you're used to going to bed at a certain time, and now you waking up and staying up to 2 or 3 o'clock in the morning, so many of our sleep patterns are off right now. That's why I'm mentioning this. You got to slowly get yourself back into that routine where you were before this pandemic started of going to bed at 10. And when you see yourself doing those things, it will help to settle you some and help to strike a balance. So those are some practical tips.
Here's an acronym, and most people it's becoming commonplace now. PTSD. They used to be relegated to the armed services and those that, again, were in the wars. In fact, when people came home from Vietnam and Korea, they just probably labeled them as crazy back in the day. But now we're finding that this is going beyond things that people are experiencing in the armed services. Today, right after the video broke of the incident in Minnesota, and that was horrific. Doc, can you give me 1 minute here?
Absolutely.
Um, because I'm a strong person,
Hmm.
strong-minded person, and today, when I saw that video, that was a rage inside of me where I didn't know whether to freaking go out here and just lose it, or I was trying to find some way to be logical and say, what can we do, this station, to be a catalyst and galvanizing people where we can move forward, where this type of thing stops happening, because we just have dealt with Ahmaud Arbery. We just dealt with the FedEx drivers and being accosted by people trying to do their job. We just kind of getting over the young man out in Des Moines, Iowa, that was going to his girlfriend's house and that was beaten, severely. And then we have this on top of that. I know that there are a lot of people like me right now that are strong minded people are wanting to say, damn it, this is enough.
Yeah.
And so help us to channel our anger, our frustration, and here's the part that got me. When the officer, not only did he stay on the man's neck 5 minutes, but once he got up and they put him on the gurney, it was like business as usual for him. It was like no remorse in his face. It was like lights were off for him. So I know that thousands of people right now, because this video is viral. Doc, talk to us, help us right now, because I know I'm not the only one. There's got to be people that will be watching this afterwards. Help us.
Let me tell you, I'm enraged also, and it's okay to be enraged. So let me start there. Uh, I think sometimes people feel like, should I feel like this, or am I wrong to feel like this? No, you should feel like this. This is not right, and it's okay to be frustrated, enraged, just plain mad. So let me just say that. Um, and now what we have to do is channel that anger and frustration into something that is meaningful. I go back and I look at our civil rights leaders. Um, they were fighting for us for things that should not have been done to us. I mean, our whole country was built on slavery. So we have to just recognize that racism is part of America, just like it's just part of baseball and American pie. So racism is here. Racism is real. But one of the things that I learned watching the different civil rights leaders, and you can name so many different ones, that they learned how to be able to channel that frustration, that anger into something that was meaningful. Now, how do you do that? Every person is different. I'll be honest with you. I don't have a magic recipe. I don't have a magic formula. I'm not going to sit here and try to say, well, this is A, B, and C. Y'all would probably laugh at me. But I want you to know that, first of all, it's okay. And then you need to find something that is meaningful to let people know that you are woke, and that you're not going to tolerate this. I just told a patient today. I just told a patient today who supposedly has a mental health disorder, and he does have a mental health disorder, but people look at him as quote unquote retarded, and he uses racial slurs to talk to some of the caregivers that he has at his facility. He calls them black monkeys. Let me tell you what I did today. True story. I called the house manager, I called the caregivers, and said, if he wants to remain a part of my caseload, it ends today. Then I called his mother, and I told her, oh, Dr. Shepard, oh no, Dr. Shepard, I didn't raise him like that. I didn't ask you how you raised him.
Mm-hmm.
Your son is smart enough to know that he will not use those terms, that he should not use those terms. And I just laid it out. So that's what we have to do. We have to draw the line in the sand and say, I will not tolerate this. Now again, that doesn't necessarily apply to, with this particular situation with the gentleman who's on the ground with the policeman with his knee in his neck. He can't, say that I'm not going to tolerate this anymore. As far as that particular incident, but we can tell the police departments, we can let the people know in governmental officials, in governmental places and officials, that we are not going to tolerate this anymore. And I hear people saying that, but we got to make sure we get to the polls. We got to make sure that we advocate for our Black businesses. We have to make sure that we're advocating for our Black non-for-profit organizations that are helping build up our people. We want to make sure that we're educating. We have to go to the people. Many of us know people who are doing illegal crime, who are doing things that they should not be doing. We have to let them know, hey, we have to end this, and we need to work together so that we as a people can stand strong and do better. Let me tell you, if we don't do this, we are developing a generation who has become desensitized to trauma. That's the end result. Again, I'm here in Baltimore. 5 years ago, Freddie Gray uprising. I was dealing with children who worked at. They weren't working. They were part of treatment at Day Hospital at Johns Hopkins. The guy working was a Black gentleman who was the transportation driver. He was scared to take them back to that area where all the uprising was. Let me tell you what the children said. What's wrong with you? We're used to this every day. We want to go back home. There was no fear inside of them. That trouble, that thing, and you see 5 years from now, that still bothers me to this day, because if we don't learn to work together and say enough is enough, no tolerance, vote people out. The commissioner in Minnesota should be held accountable for these actions. Now, I know some people might disagree with, well, he wasn't the one who did it. Well, there needs to be some type of persons who are in that position, held responsible for sensitivity training. That's something that is happening here in Baltimore. We've got to make sure that we understand and provide these education training. So these are some of the things that I would suggest, again, but utilizing this anger and putting it into something meaningful to make sure that people understand that enough is enough and we're not going to play no more.
Absolutely. I spent some time as a police chaplain, and I rode in the cars with the men and women of law enforcement. My son is in law enforcement, that whole side of the family. So I understand the stress levels. Not only is there stress in the street and they're thinking about trying to make it home, they're thinking about their families. And then a lot of them, they're like us, just because they have on a uniform, they still have domestic problems. They still have unruly kids. They face the same things that we face plus the dangers of the street. And I'm not by any means condoning any bad behavior by anybody, uniform or not. But what I'm saying is that I'm putting out a challenge out here is that I'm asking more of our clergymen, especially black clergymen, to become police chaplains, because that way we cannot have change if we're on the outside. In order to start change, you have to start change from the inside. So if we can be there, I attended a meeting not too long ago of some regional chaplains, and guess what? I was the only African American chaplain sitting there. I was the first African American chaplain in a place that they call Colonial Heights, but they call it Colonial Whites. What I'm saying is, Doc, is the fact that right now I've gotten away from being a chaplain for over probably about 16 years now. And what has prompted me recently is to go back into a department, one that's predominantly white, where I know that hopefully I can make a difference. And I think that's what we have to start saying is that where do we find our niche where
Yeah,
we can make a difference? Would you agree with that, or can you
absolutely.
expound on that?
Absolutely, yeah. Thank you for directing me toward that direction. Uh, so in my practice, in my busy practice, I still work for a non-for-profit. I'm the president of board of directors for the Black Mental Health Alliance because I understand that my work is not just me to get a paycheck. It is my mission and my passion to help to people to live their best lives. And how to be able to do that is you have to figure out what is it that you can do on this earth. You've been given a call. You've been given the potential to do anything on this earth. And really, mental health is all about potential. That's one of the major factors of mental health is potential, your ability to cope, your ability to work, and your ability to make a contribution to your community. That's what mental health stands for. And so, if you understand that, then you really are tapped into why you should care about the mental health of our youth, care about the mental health of our elderly, our most vulnerable populations, and then care about your own mental health. So find out what that is. I agree with you. We have to make a difference, even if it's through your church, the faith-based organizations. They represent strong pillars in our communities. So it's not just going to the worship service. It's also seeing what can you do, maybe through your faith-based organization. Let's think about sororities and fraternities. Those are strong pillars within people of color, and not just people of color, really all ethnicities. And so, look at how you can make a difference. Um, Again, going to the polls. This is an election year. We want to make sure that our voice is heard, not just regarding the president of the United States. That's just one person. That's just one position. There are many other things that are going on within your own local state that you want to make sure that you're out there making a difference, making your voice be heard. Letting again people know that enough is enough. I'm not going to tolerate it, just like I told that mother. And I didn't have to say that, but I told her I'm not tolerating it. And I guarantee you he won't be using those words again. So just something that simple. Yeah.
We're going to take one more comment. I want you to expound on this. Jessica had another comment. She said, I also believe that there was a point in time that the only focus of the man and woman was to provide for the family and keep bills paid. There was no time for mental health. A lot of challenges that young adults like myself have today are different from those that they faced in the 50s and 60s. Times have changed. What do you say about that, Dr. Shepard?
Times have changed. I wasn't born back in the 50s and 60s. So I can't go back that far. But I'll say this though, that even the last 10 years, I've been here in Baltimore now for 11 years, and times have changed here. I have seen where uh, many of the black people, they've left Baltimore. You might say, well, I didn't know they moved around, but if you look at the population stats, Baltimore has decreased as far as its population. So times have changed. One of the major reasons why times have changed, we just talked about it earlier. You can get news so rapidly now. Social media has changed really the fabric of the society. News, the way in which we handle business, everything is such fast paced, very quick, and if you don't get it within a minute, the internet was one of the life changing things that occurred in the late '90s or
Mm-hmm.
so. So, yeah, times have changed. But let me tell you, even though times have changed, people are still people. Um, People like to be touched, which is one of the reasons why this pandemic has hurt so many people. We have five emotions that we've been given, and touch is one of those. And the fact that now you can't even touch has really upset people now. Um, People like to hear and like to be seen. That's why you see so many different things on Facebook now. People want your attention. Everything is attention grabber because it's very visual. People are very visual. So those things have not changed. Um, I will say this. We now have more permission to take care of ourselves, especially with people of color. There was this thought that all you did was just work, you just work, you just work, and that mentality had been passed down from generation to generation. We were taught not to take care of ourselves. We were taught just to do whatever you're supposed to do and don't say anything without complaining about it. And so those things have changed. Those attitudes have changed. Those ways of thinking have continued to change. And so, those are just some of the things that I notice. I've noticed it even with our children. Let's take it for instance with parents who try to help their children out with this whole homeschool. these these parents talk about Dr. Shepard. I need to come see you because they stressing me out.
Right.
Yeah. So that's just another example of how some things have changed. But yet answers are still the same, but the methodology on how to get to that answers has just changed. So I guess what am I saying is that the methods will change. We have to adjust with society. And with that said, there are more stressors, there's more pressures that are even more intense now. And you must take care of yourself because the fact that we don't allow our children to go exercise, they've cut exercise out of classes. They cut so many other things that were good for our mental health, our physical health, and so now we don't even know what it is to go ride a bike. We don't know what it is to go chill and relax. All we know chill and relax means to go play a video game. Man, no, I mean,
Mm-hmm. Right.
and so those things we have to get back to. And so I think I understand the spirit of her comment, spirit of her question. So I definitely agree. And so we got to make sure we take that time so that we can rejuvenate ourselves. This is a time where we have God. I believe God has allowed for us to reset. So take advantage of this time. You may never get it again.
I like that. In fact, I got to post that word as we get ready to close out. I want to, Dr. Shepard, continue if whenever your time affords itself and allows itself to come back because, again, we cannot in one setting deal with all the nuances of mental health. We just basically kind of laid a foundation here and just scratch the surface because even talking about the PTSD, there's so many facets of that, and so many people now are experiencing that, and that again, this is real. It's just like some people don't feel that COVID is real. Well, PTSD is just as real, just as damaging, in my opinion,
Yes,
and we need time to deal with that.
absolutely, absolutely. I agree with you wholeheartedly. This is not a sprint. This is a marathon. So we got to make sure we're built to last.
Would you please let everybody know how they can get in contact with you on your social media? And also, a lot of people are not in the Baltimore area. Uh, can they perhaps contact you and say, well, I'm in Richmond or I'm in this town. Can you recommend somebody that's in their area?
Absolutely, absolutely. I'm thankful that I am teamed up with a large network of psychiatrists throughout the country. Even there in Richmond, one of my mentors is down there, who has been very instrumental in my practice. So people can reach me. They can go to my website, drjonathanshepherd.com. You can send a message that way, and I'll get it to my email. And you actually can just email me directly at jshep, JSHEP 2471 at gmail.com. I'll answer questions that way too. You can even call me at my office, which is 410-265-8737. That's Hope Health Systems, and we'll gladly take that phone call. They'll get it to me. And again, I answer questions for people all throughout the country, and I try to at least hook them up. There's so many different national resources that we have, and so if I don't know anybody directly, then I'll link you up with one of those national resources.
And I put on the screen drjonathanshepherd.com. Is that correct?
Yep, absolutely.
And he has a fantastic Facebook page. You guys can find him on Facebook. Are you on Twitter as well, or is that just not something that you care to do right now?
Yeah, no, I do most of my stuff on Facebook. It's I'm gonna have to have me somebody who can help manage all this to the practice and social media stuff. But yeah, you can find me on Twitter too. My handle on Twitter is Dr. J Shep. You can find me on Facebook, Dr. Jonathan Shepherd. That's my professional page. And then my Instagram is also Dr. J Shep. So yeah, so you can hit me up those ways.
You know, Dr. Shep, they say closed mouths don't get fed, right? So I heard you say that you need some help with that social media. So that's what we do as well. We manage people's social media. I have a team. In fact, we have a page. It's Cruz Inc. Up in DC, Maryland. So we have somebody that's actually one of our affiliates in that area. So I'm not. That was a shameful plug there.
Hey, I'm glad I said something.
Yeah, we have to go out with laughter, man. And I want you, as we close here, and this has been a fast hour here, about laughter, because we just had a moment right there, even though it's been serious. I think that maybe some people think sometimes that even in the midst of this craziness, it's not good to laugh. What are your thoughts on that as we close out?
Oh. I've been laughing. I love to laugh. Anybody knows it, and it just changes. A laughter will literally change your whole body. It literally It induces certain hormones or neurotransmitters within your body. So laughter is wonderful. It will reduce your stress and anxiety. So laughter is good, just like medicine. Laugh at yourself. Parents, laugh at yourself when you can't remember how to do that work that your child is struggling through. Laugh at yourself when you look at how you look in the mirror. You haven't had a haircut in weeks. Just laugh at laugh at yourself, and it's just something. I was about to say laugh at how you may look, but some people might get offended on that, because some of us are eating more and more. So I God forbid, I'm not saying that, but
right.
The whole facial thing, and I'm seeing some hair that I haven't seen before. Now again, it's just easy for me. I just shave it. But if I didn't shave it, man, so I have to just laugh at myself. But it's good. It's good to laugh. You can even laugh at what you hear on the news without even calling names, because you can hear some funny stuff.
Yeah.
The stuff that you be like, okay, this person really don't have it all. So just laugh at it, and then do something about it. Just in that case, about it.
My wife may send you a check, man, because she said, and I'm generally pretty stern. I very seldom laugh, so you made me laugh today. So you might get a check from her. because you made me laugh. Because most people that know me, they all my pictures, they say, "Do you ever smile?" I'm saying, "I am smiling. I'm smiling on the inside."
Oh, that's good. That's good.
Yeah. But thanks again for taking time out of your busy schedule today. I know you had clients to see, and then you rushed right in to be a part of our show. And I want to extend this opportunity for you to continue to come back and be a guest and provide the crucial information. And thank you for what you do day in and day out to help all of us that need help sometimes.
Thank you. I appreciate that. I'll be glad to come back. And I just want everybody out there to please stay safe, stay healthy. Remember, your mental health depends on your potential, your ability to work, your ability to cope, and your ability to make a contribution to your community. So that's why mental health is important.
One more time, Dr. Shepard, let everybody know how to find you, because I want to make sure that after this program, if they need to reach out to you, because this is part of our mission here, is that we provide not only information, but we provide resources for people to get help.
Absolutely. So again, you can go to my website, drjonathanshepard.com, and you can, again, send me a message that way. You can hit me up on Gmail, jshep, JSHEP2471 at gmail.com. Or you can call me, 410-265-8737. That's Hope Health Systems. They'll get the message to me. And then you can go on my social media pages, Dr. Jonathan Shepard. That's how it looks as far as the spelling. Make sure you spell it. There's only one Shepard, so make sure you spell it like that.
All right. Doc, we will be in touch, man. Enjoyed it. I think the information that you provided is phenomenal, and that it's going to transcend beyond this show, because, again, we're going to be posting this on all of our social media outlets, and it's going to be out there on YouTube for people to go. And I want to say right now, if you have not subscribed, go to Cruz Inc. Radio 102.8 TV on YouTube channel. And that way, if you miss something, you can go back and listen to the good doctor and get all this great information. Man, thank you again. Have a blessed evening. And I look forward to the next time that we get together. I'm going to try to get Dr. Varner on here with us so we can have a panel and really drill down into some things.
Yes, sir. Yes, sir. Great guy. I look forward to it.
Fantastic. You have a great night, Doc.
All right.
All right, everybody. Thank you for tuning in to Cruz Inc. Radio 102.8 TV Live. We've been talking to Dr. Jonathan Shepard. He, again, is a psychiatrist up in the Baltimore, Maryland area. I want to say this as I close here within the last 2 minutes, is that mental health is a serious matter. And if you need help, please reach out and get help. These are some very difficult times. We are going through a new norm, as you keep hearing us say. So don't be afraid to reach out and get help, because, again, your mental health will impact everything. It will impact your ability to heal from certain ailments. It will also make again, just the simplest things more difficult. So please, if I have any influence at all, I want to tell you right now, and I want you to do an exercise. After I close down, I want you to post on here just this simple little exercise and say, I am so tired of COVID. And we want to use that as a release. So right now, post on this in the comments. I am so, if you want to say I'm so damn tired of COVID, say that. Let's start some release right now. This is Cruz, and this has been Cruz Inc. Radio TV, and we thank you for tuning in. Be with us. Make sure you subscribe to our Cruz Inc. Radio 102.8 TV YouTube channel. Go to our Facebook page, which is Cruz Inc. Radio. Thank you. You all have a great night. God bless you.